What we found at our office is we were getting an increasing number of patients calling us with issues about accessing medications that their doctor wanted them to have. And so we decided, we've actually always believed that that a patient can be their own best advocate, and that's very good for them to be their own best advocate. So, but they need the tools. So we put together a toolbox of tools that they can use, letters, samples of letters, how they can go through the appeal process. We know they have to be patient. We know they have to be persistent. But these tools can help them through that process. We also have a website, and then that website also will give them the guidance they needed to appeal if they are caught in this step therapy where they can't access the medication their doctor wants them to have. If patients that have chronic illnesses or chronic pain or cancer patients, they need specialized care. That's just not a visit because you have the flu, you go to the doctor, you get medication, and you're treated and you get well. This is a long time commitment with chronic illnesses. And in the case of cancer, it's specialized treatment. So you need that professional with the training to treat your particular autoimmune disease or your, for instance, pain. Not everybody, all pain is not the same. So you need somebody who understands pain, understands you, understands what's going on in your medical history. So yes, they need specialized care with chronic illness, more so than the general public who does not have a medical issue.
I think exactly what the organization is titled, Let My Doctor Decide. Unfortunately, it's really been taken out of our hands, and if we don't agree with the step therapy, all we can do is try to appeal and fight with the insurances. It's really what it's doing is it's raising costs in the office. We have a person in the office who's only doing prior authorizations, who's fighting with the insurance companies, and we expect denials on these patients immediately. We know we're going to get denied, and then we have to write letters, and it takes away from patient care. I tell my patients now, the hardest thing in medicine is not diagnosing or trying to determine what treatment I want to give my patients. It's really getting them the therapy that they need, and that's sad. That's not why I went into medicine.
That's right. And I will make another comment of just another type of example that I think we've all experienced in our field of another patient with rheumatoid arthritis for whom a medicine was recommended called Kevzara, and it has a mechanism of action different from drugs that this person had been on before and failed, such as Enbrel and Humira, and those are in the same family of drugs called TNF inhibitors. Neither one of those worked for the patient, and going to the drug company with the other medicine that works differently in the body than the ones that had failed, they denied it, stating that you need to try Cimzia or Simponi first, which are both in the TNF inhibitor family, going back to the same well that was dry for that patient. Everybody's body chemistry is different. There is actually a lot of weight put on evidence-based medicine these days, meaning that there's been scientific research to back up decision-making. And there is research in the medical literature showing that once you've tried at one or two or even one in a certain class of medicine that works a certain way, it's somewhat undesirable to go back to that same family of medicine that already has failed when there are a few in the other families that work differently in that person's body. And yet they said, no, you have to go back and do a third in that same category that already had been proven to not work. Not making any sense whatsoever. And this is frustrating for physicians whose main goal is to help the patient to get better and to feel better.
Yeah, I've experienced that also, and exactly what Dr. Kesmer was saying. If somebody fails a TNF, and we talk about primary failure or secondary failure, primary failure means they didn't respond at all, putting them on a second TNF drug is going to do absolutely nothing. And we know that these patients are having active inflammation and they're suffering, and you're going to make them go through the process of a drug you know is going to fail just to meet these criteria.
Yes, and so these steps therapy rules, in certain cases, for example, the ones that I brought forward, are running in the face of scientific evidence, which is what we as physicians are taught to use as our guideline for success. This makes no sense in my mind.
It's very frustrating because they depend on their doctor to make the best choice for them. And even then, a patient can have a fear that the doctor would rarely want to prescribe something but doesn't even try because they know they're going to have 2 hours of work and appeal process. So patients have that fear that a medication that might be available that might work for them might not even be tried just because of the frustration around this step therapy process.
What do you think might be an optimal solution to this problem?
Well, one, let's put decisions back in the hands of the doctors, because that's where it belongs. And when we make cost-based decisions, we often cost the system much more. Everybody understands that we have to keep costs down in healthcare, but it has to be done prudently, and it has to be based on science and facts, not on just the wishes of somebody sitting there making a decision which, in my mind, they have a conflict of interest. Sometimes we hear that physicians have a conflict of interest because the pharmaceutical company may send in salespeople, and God forbid they give them a cup or something. Like a doctor might make a decision based on that. We have a benefit manager making a decision based on what will benefit them directly. They actually financially can profit from their decision, and that is a true conflict of interest, very, very, very serious for patient safety.
And all the insurances have the pharmacy benefit managers making those decisions.
I am opposed to step therapy for the reasons that we've reviewed today, and I would like to put a higher priority on what is indicated for the patient based on evidence and science. And I'm very happy that Let My Doctors Decide is available for patients to use as a resource.
Ms. Ladd, any final comment?
I'm pleased that we can bring these tools to patients so they can be their best advocate, and I think that it's very important that the doctor-patient relationship is tightened up again, and is so the patient can trust that they're getting what they need to treat their disease.
Yeah, I think I mirror what's been said, and I also want to say that even when we meet the criteria for step therapy, they find reasons to deny our treatment sometimes, and it's just a massive amount of paperwork that's adding to the cost of medicine. It's been shown that 95% of prior authorizations are eventually approved, 95%. So what are they actually doing when we fight? We have to fight and try to get things going, and really let the doctor decide. That's the main thing.